A 59-year-old patient with a history of recurrent acute pancreatitis presented with a 115-pound weight loss, abdominal pain, and an inability to tolerate even liquids. At EUS, he had findings of chronic pancreatitis and diffuse inflammation in the pancreatic head and jejunal, with thickening of the wall of the jejunal bulb that was classic for groove pancreatitis. A decision was made to perform Eus-Guided gastroenterostomy. However, the stricture in the jejunal bulb was too stenotic even for a guide wire passage, and despite balloon inflation, the instilled contrast could not seep into the small bowel. At EUS from the stomach, the collapsed intestinal extragastric loops were identified. A 19-gauge needle was advanced into the small lumen of the extrinsic bowel loop, and normal saline mixed with diluted contrast and methylene blue was instilled via the motorized jet pump. 0.5 milligrams of IV glucagon was administered to decrease intestinal motility. On fluoroscopy, the distended small bowel loops were identified. A loop of bowel closest to the stomach was identified, and a 15 mm by 10 mm Axios luminous metal stent was placed to create a gastroenterostomy. Post-procedure, the patient was advanced to soft diet within 24 hours and discharged home. The two main indications for this newly proposed method are 1. When the duodenal stricture is too tight and the distal small bowel cannot be accessed for placement of a saline instillation catheter, the demonstrated technique could be an important salvage measure. And 2. When the stomach is grossly distended and a catheter cannot be passed successfully into the small bowel, the proposed technique can yet again be an important salvage method. The main advantage of this newly proposed method is that a gastroenterostomy can be undertaken successfully by identifying a loop of small bowel closest to the stomach, which sometimes may not be possible when using other methods. To learn such novel tips and techniques from internationally renowned experts in informal breakfast sessions, please attend Florida Live Endoscopy from August 20th to 22nd, 2026 in Orlando, where the magic of endoscopy begins.
On behalf of the entire team of the Orlando Health Digestive Health Institute and our Center for Advanced Endoscopy Research and Education, we extend a warm invitation to join us on August 20 through 22 in Orlando for Florida Live Endoscopy 2026. This will be a unique meeting where we will celebrate the accomplishments of a generation of endoscopists while exploring the future of endoscopy. This will not be just another endoscopy conference, but rather will be a unique and lively gathering that spans generations, highlighting pioneering techniques and innovative breakthroughs. Prepare for a fascinating journey through the evolution of endoscopy. You will experience live demonstrations of the latest procedures, connect with renowned experts worldwide, and gain valuable insights from leaders who have shaped our field. Discover the expertise of 20 renowned international faculty members whose remarkable insights will elevate your learning experience. Celebrate the legacy of endoscopic pioneers and witness the future of endoscopy unfold. Register today and become part of this remarkable journey, where tradition meets innovation in the continuous evolution of endoscopy. Save the date for Florida Live Endoscopy 2026, the premier event showcasing history, excellence, and upcoming advances in endoscopy. Florida Live Endoscopy 2026, where the magic of endoscopy begins.